All right, so observation of the day is when you're working on somebody who's very muscular, very strong, you do not have to beat the crap out of the muscles. By understanding the method, the flow differential method that I have created, I was able to assess all the problem areas, his flow differences, as far as the way his body was compensating. Once we got those compensations to be kind of reorganized within his system, then the whole system was eager to um, move the fluid off of the system. So, like, he came in, let's say this person had um, lower back tension, palpating on the lower back, there's pain, corrected the flow, blood flow through the shoulders, scapula, lats, ribs, all that stuff, with just the use of a towel was enough, and releasing the posterior delt was enough to redirect that flow from going into the chest wall into the upper trap and cycling through the way it wants to go. Once that was done, then the glute system saw it was easier to soften. Even with activations, there was no deep tissue on the hamstrings or calves. I could put just some thumb pressure into the hamstrings initially, and you would tap out with hardly any pressure. So we released the shoulders, we released the glute system with activation with drape down with permission, and then the calves and the hamstrings didn't even need any deep tissue. I could push deeper, and there's no pain, so there's really no need to work that. Um, I did a little bit, but not. I mean, he wasn't tapping out by any means. So if you have a big muscular person, knowing how the body actually cycles the fluid through the system. Now, granted, if I would have started him face down, I would have been so tired so quick from working on him because he's so muscular. But um, working supine, opening his system up first, posterior chain was really easy to work on. He felt a lot of relief, and yeah, it was a good session.